what is a DJ stent? Many patients get scared when they hear the word DJ stent. So actually, some people even think that it is a permanent thing, something which doctor is putting permanently inside their body. But actually, it is not so. Doctors use this pipe to basically treat your kidneys, treat your overall health. Doctor, will this pipe stay inside forever? This is the main question asked by most of the patients. But the answer is no. The DJ stent is a temporary plastic or what we call as a silicone material which is used to divert the urine, and it is the most common and helpful tools in urology nowadays. So today I will explain what exactly is a DJ stent, why doctors put it, whether it causes pain, and when it should be removed. So if you are someone or in your family has been advised a DJ stent, this video will clear all your doubts. What is a DJ stent? DJ stent is basically a tube to connect the bladder and the kidney internally. It has two curls, one on each side. One end is in the kidney and the other end is in the bladder. Now, why is it called a double DJ stent? This is the reason, because it has two curls. Now coming to why do doctors insert this DJ stent? There are multiple situations where we use DJ stents. The most common being kidney stones. Any surgery, any procedure in urology, we always use a DJ stent, especially stones. So when a stone blocks urine flow, pressure is built up in the kidneys, which can cause severe pain in even infection. A DJ stent immediately relieves this pressure and protects the kidney. And this helps to relieve the pain as well as infection. So after any stone surgeries of the kidney, any stone surgeries in the ureter, during infection, obstruction, also after renal transplants, or when there is swelling which is temporarily blocking the urine flow, we use these stents. So think of it like a temporary bypass road for urine. Think of it as a refill in the pen. So coming to next, how is a DJ stent inserted? It is a simple technique. Many patients imagine it as a big surgery, but it is not so. The truth is, it is a endoscopic procedure in which we do a procedure through the urine passage only, natural orifice, no external cuts, using a small camera which is called as a cystoscope, and the stent is gently passed into the ureter through the bladder, and the procedure usually takes 10 to 20 minutes, and many patients go home the same day or max to max next day. And it depends on how many days the patient has to stay, for what purpose we have put the stent. If it is a simple stent just to relieve the obstruction, as I said, the same day or next day. But if it has been put for some procedures like after a ureteric injury or after some major surgeries like partial nephrectomies or some other surgeries where ureteric reimplantation has been done, then in that cases we discharge after 5 to 6 days, and the stent is also kept for a longer period. So depending on what symptoms patient can have with the stent, we can treat them accordingly. Now this is something patients ask frequently, what symptoms we have when we have the stent inside our body. Most of the times these are irritative symptoms, and these are like frequent visits to the toilet, pain while passing urine, blood in the urine, sometimes back pain in the kidney area, sometimes burning in the urine. So most of these symptoms easily settle down with good amount of fluid intake. And why does this happen? Because the lower end of the stent irritates the bladder wall. So if you drink lots of water, the bladder is distended and the stent will not touch the walls of the bladder, and these symptoms automatically subside. But even though if water intake doesn't help, then we have to give medications to suppress these symptoms, and these are usually temporary and manageable, and these are quite less compared to what the pain you experience with the stone. So doctors often prescribe medicines if it is not resolved with water intake. Next question patients have, can a DJ stent stay inside forever? This is very important. The stent is a temporary thing. It should not be forgotten. The doctor definitely, and we as a urologist always remind the patient that there is a stent and you have to come to get it removed. And it's also a moral responsibility of the patient to get it removed and meet their urologist. whenever they have been asked for. So as we know, they are temporary stents, so have a definite lifespan. Few stents can be kept for 3 months, few can be kept for 6 months, few for a year, and very rarely there are stents which we call as metallic stents can be kept for years, and these were used in those patients who have cancers. Stones we usually remove after 15 days, for infection also 15-20 days, and for surgeries like ureteric reimplantations, pyeloplasties, or any injuries or laparoscopic partial nephrectomy, we keep for 4 to 6 weeks. This is why patients must always follow their doctor's stent removal schedule. How is this DJ stent removed? This is a very simple, quick procedure. It's a daycare procedure. The patient comes to the OPD or in the daycare setting and get it removed through the same passage through where it was putting a camera and removing it within a few minutes. So most patients go home immediately. No need to worry about how to get stent removed. It is a very simple procedure. Now coming to common myths about the DJ stents. There are few myths. Let me quickly clear these myths. Will this damage my kidney? Actually not. It in fact protects your kidney by removing the swelling, by decreasing the infection, by relieving your pain. Stent removal is painful. This is one of the other myths. But actually it is a very quick and usually well tolerated procedure. No need to worry about stent removal or stent putting. Some says stents means a permanent problem, but temporary support is the main reason for which we are putting the stent. When should you contact your doctor? When you have a stent in your body and if you experience any of these symptoms, then you should immediately contact your doctor, like fever, high fever, severe pain, heavy bleeding, difficulty in passing urine. You should immediately consult your urologist so that they can be dealt with. If you or your family member has been advised a TJ stent, don't panic. In fact, it is a very common and safe procedure in modern urology.